Hi, today for my video project, I'm going to be talking about stress fractures and shin splints. So first off, we're going to talk about stress fractures. Stress fractures are defined as small hairline cracks in the bones that result from repetitive stress. So what exactly is a stress fracture? So rather than acute trauma, stress fractures are caused by physical activity over time. They commonly occur in the weight-bearing bones of the leg or foot due to weight-bearing activities, such as running or jumping or anything that is putting pressure on those bones. Pain usually occurs as a dual ache and then progressively worsens over time. So initially, you'll experience severe pain during activity, but as the fracture progresses and gets worse, pain will be more prevalent following activity. So the anatomy and physiology of stress fractures. So like I said, they occur in the weight-bearing bones, such as the tibia, metatarsals, fibula, femur, navicular, and calcaneus. Those are the common bones that stress fractures are often seen. So the formation of it, the rate of breakdown exceeds formation. So the bones are breaking down quicker than they can form. This leads to the weakening of the bone over time and leads to these small microscopic cracks that are the stress fracture. So microtrauma, that's repeated stress that's causing these microscopic cracks, such as weight-bearing activities like jumping and running that can cause these cracks to form over time. Another factor is fatigue. When people are experiencing inadequate recovery time, this can lead to the coalesce of microscopic cracks. So they can progressively get worse over time if the athlete is not recovering well or fueling enough and just constantly putting that pounding on those bones. So, like I said, athletes, that's the common population for people with stress fractures. It's common in high impact sports such as basketball, tennis, running, gymnastics, etc. It's that physical activity that's putting the constant pounding on these weight bearing bones that progressively gets worse over time. So, the progression of this. First, you have the crack initiation, which is the formation of microscopic cracks at the sites of stress concentration. So, as you can see in this picture, it's an image of the bone cells, and we can see these microscopic cracks beginning to form, developing into a stress fracture. So, after the crack initiation, we have the propagation. So, when loading is continuing to happen, these microscopic cracks can propagate and coalesce, which leads to a visible fracture line as we see here. So, it constantly breaks and breaks until we get that visible fracture line that doctors can identify with proper imaging. The bone stress continuum. So, at first, we have a bone strain or stress response. The cells in the bone are stressed and they're beginning to weaken. They're breaking down quicker than they can build back up. So then that creates a stress reaction, which then develops into the stress fracture, where we can then see the fracture line as is seen in the x-ray right here. So imaging. Stress fractures are more easily seen on MRIs rather than x-rays. They do not appear on an x-ray until the osteoblasts start to lay down bone. So on x-rays, usually when someone is recovering from a stress fracture, you see a big lump on where the stress fracture was, and that's because the osteoblasts are starting to lay down the bone as it's healing. And that can be seen on the x-ray, but when you're initially dealing with the stress fracture, it is harder to see it on the x-ray, and doctors typically recommend that patients get an MRI in order to find that. So that's often suggested because an MRI can visualize the early stages of the stress fracture. So if it's a stress reaction and then it develops into a stress fracture, and then it recognizes bone edema, which is inflammation of the bone, and it can also grade the severity of the stress fracture based on the fracture line and the inflammation of it. So treatment. Initially, we want to rest. If we have the fracture on the bone, it's important to step away from activity. Immobilization is recommended. Stress fractures usually do not require casting. They typically require a boot. I recently had a stress fracture, so I actually have for my item to show, I have my walking boot that the doctors put me in. I had one on my metatarsal in my right foot, and they also could not find it on an x-ray, and I had to get an MRI done in order for them to find the stress fracture in my metatarsal. But I was put in a boot to immobilize my foot, and that reduced stress on the bone and allowed it to heal over time. For pain management for this, avoid pain aggravating activities. We don't want to put weight on that. We don't want to irritate the bone more than it already is. You could take over the counter pain relievers such as ibuprofen to manage pain and inflammation. So it's important to do a gradual return to activity once the bone is healing, and physical therapy can be done to strengthen the surrounding muscles of the area. So, doing physical therapy exercises in order to strengthen the muscles and improve flexibility. So, prevention. We want to do a gradual progression of physical activity. This means having proper footwear as well, wear supportive shoes, and replace them regularly. When you're doing these high impact activities all the time, the shoes are constantly wearing down, that puts you at more risk. In the gradual progression, we want to ease into things. You don't want to go full swing because the bones will go into shock. For nutrition, vitamin D and calcium is very important in order for bones to be healthy and strong, especially when you're putting a lot of pressure on them on a daily basis as an athlete. So you want to have a diet rich in that and make sure that the athlete is consuming enough calories, so that these fractures don't continue to happen. Recovery, you want to do low impact activities such as cross training, swimming, cycling, yoga, etc. That will take pressure off the bone. We want to stay away from running, jumping, plyometrics, weightlifting. And then rest is very important. We want to take days off from physical activity and aim for quality sleep each night so that the body can recover. So, like I said, I've actually had three stress fractures, so I have a lot of experience with this injury, and these are some of the things that I was prescribed to do to recover from this. I used the anti-gravity treadmill. This took a lot of weight off the bones because I could run at, say, 70% body weight, 60% body weight. It took weight off the bearing of my bones when I was running, so that way I could increase my cardiovascular fitness but still allow that injury and bone to recover. And that's the same for aqua jogging. You wear an aqua belt and you're basically running underwater, so you're not putting impact on the bone. And same for cycling. These are just great ways to get my heart rate up and allow the injury to heal. And then, like I showed you for my item, I was in an air cast walker boot that just helped take that pressure off the fracture when I was walking everywhere. The other thing I did was blood flow restriction. This basically restricts blood flow and allows me to get more. It was allowing me to maintain my muscle while I was in the boot and restricted from doing these weight bearing activities, because it was restricting blood flow. So I would put this on and do exercises in the training room, like physical therapy stuff. And then I would wear it in the weight room and do like body weight stuff so that it could be more similar to me lifting heavy weights, but I wasn't putting that impact on my body. And then I also had a carbon fiber insole in my shoe, that kind of helped relieve the impact on it when I walked around and just to make it more comfortable when I progressed out of the boot. But yeah, the significance of all these was to make my recovery better and help me to stay in shape, and heal from the injury. So medical clearance, they typically prefer return to activity protocol. We don't want to rush back into things. We want to have a structured progression of physical activity. So we want to progress from low impact to weight bearing and then to sport specific movements. You don't want to just go straight into the sport specific movement. So say we start out with biking and then we go to the elliptical and then we go to the anti-gravity treadmill and then we're running on the ground and then we're doing plyometrics. So you want to have a smooth progression into things. And then a strength and mobility assessment, functional testing, test the muscle strength and joint mobility, make sure they've returned to pre-injury levels before we go back before we go back to where we were before the injury. And then imaging and clinical symptoms. Doctors typically want to check and see if the bone is healing over time. I've had to get three different x-rays to make sure that my stress fracture is healing, and you can see those osteoblasts on there, healing the bone because it has that big lump, like I said, on the x-ray. So doctors typically recommend that. And we want them to be pain-free before they resume activity again. So the next thing is shin splints. This is pain along the shin bone caused by putting too much stress on it. This is a very common injury in athletes, and it's also defined as medial tibial stress syndrome. Um, this is increasing pain at the distal two-thirds of the posterior medial aspect of the tibia. And there's daily movement may be painful, and then you may experience morning pain and stiffness. So this is just pain up along the shin muscle that athletes will experience just from impact, just like stress fractures. And shin splits can develop into stress fractures over time, so it's important to properly diagnose these and keep an eye on them. So the anatomy and physiology. The tibia, which is the shin bone, is the primary location of pain. The muscles are inflamed, such as the tibialis anterior, tibialis posterior, soleus, and flexor digitorum longus. So these are common muscles that are inflamed along the shin bone. The periosteum is connective tissue that covers the outside of the bone, and it's caused by overuse. So this is repetitive stress on the shins that leads to inflammation, which causes the pain from the shin splints. And this is from running, jumping, or any high impact activity. A population for this is athletes. It's very common in high impact sports such as running, dancing, basketball, soccer, football, etc. So the pain progression. So at first, you'll get mild pain and soreness along the shin bone following exercise. And then we know if it's progressing to be worse if the athlete is experiencing this pain during and after activity, and then during, after, and at rest. So if pain becomes more noticeable during and after exercise, and then it's persistent when the athlete is at rest, there will be tenderness and swelling, and it is progressively getting worse. So these can also be identified with imaging, such as plain film or bone scan. Referral to a physician for ruling out the possibility of a stress fracture can be done with bone scans and plain films. So shin splints can progress into stress fractures, so it's important to get imaging done to keep an eye on them. Bone scans better detect these early changes rather than x-rays. So doctors typically recommend bone scans and MRIs more than x-rays. Treatment. So activity modification, we want to take that impact off. We want to avoid activities that aggravate pain, limit running and jumping, but we also want to say cardiovascular fit. So, cross training, taking impact off, and then gradual progression. And then this can also be caused by abnormal running mechanics, so we want to fix those. Pain management, you can apply ice to the affected area to relieve the inflammation, wear compression socks for that muscle tightness, elevate the leg, over-the-counter pain relievers such as ibuprofen, and orthotics to support the arches. Physical therapy can also be done to perform exercises that target the calf and shin muscles to help relieve the tension. And then we want to improve flexibility and strength and a stretching program for the Achilles complex. So prevention, gradual progression of physical activity. We don't want to rush into things. Having proper footwear, wear supportive shoes, replace them regularly, and consider arch supports. Proper warm up and cool down, dynamic and static stretching to prevent any muscle tightness, and then recovery, low impact activities, cross training, swimming, cycling, elliptical, etc., to help the shins recover. And then surface considerations, running on softer surfaces such as grass or dirt trails can also be better to take the impact off the shins. Personal experience, I've had shin splints. A lot of my teammates have had shin splints. It's very common in runners. Typically, we'll do an ice cup. So you freeze water and then you rub it along the shin bone. You can do compression calf sleeves for the calf muscles. And then this sock I actually got, it flexes your calves in the middle of the night, which is nice. And then KT taping, I've gotten that done. That also helps with pain relief. So medical clearance, we want the athletes to be completely pain-free, no pain during their daily activities. And then once they have no pain, we can start the return to activity protocol. So a progression back into things, low impact to high impact to sport specific movements, and then a movement and biochemical assessment. So this can be caused by bad running form. So, or like feet and stuff. So we want to address these underlying causes in order for this to not occur again. So having footwear stability, correcting running form, and any muscle imbalances. And these are my sources. Thank you.